Good morning. On behalf of the NC Chamber, welcome to COVID-19 Laboratory Testing for Virus Present and Antibody Response. I am Janelle Boyd with the NC Chamber. All attendees are muted to avoid any distractions during today's presentation. If time permits, we will answer as many questions as possible at the end of the presentation. If you would like to submit a question during the meeting, please use the question and answer box. Please do not use the chat box. You may upvote the questions you most want answered by clicking on the thumbs up for that question. The questions with the most votes will be answered first. The recording of today's webinar will be made available to you via email within 24 hours of the webinar. Now, I would like to introduce Tracy Butler, Senior Vice President of the Atlantic Division of LabCorp Diagnostics. Tracy?
Thank you, Janelle. We appreciate the opportunity to be here today to share our experience with COVID. While LabCorp has played a key role in bringing COVID testing to more than 1 million patients across the country, we as a business have also been impacted in our core business based on the necessary restrictions to reduce the spread of disease. So we share your desire to regain normalcy of markets. Today, it is my pleasure to introduce our CMO and Senior Vice President, Dr. Dot Adcock, who has played an instrumental role in bringing LabCorp's COVID testing to market. A pathologist by training, she's renowned nationally and internationally for her expertise in bleeding and clotting disorders for more than 30 years. Dr. Adcock reviews the science of COVID in layman's terms as you consider your back to work strategies. Heather Provino, who is the Vice President of LabCorp's Employer Services, will share specific offerings available to employers should they determine that testing is needed for their employee populations. Dr. Adcock?
Thank you so much for inviting me to speak today, and thank you to the participants for taking time out of your busy schedules to listen to this presentation. I would also like to take this opportunity to thank the members of the North Carolina Chamber of Commerce for the work that you do to collectively benefit the business community and the great state of North Carolina, and the tremendous efforts and role the Chamber plays representing our businesses in front of the legislature. If we can move to the next slide. So as Tracy mentioned, I'm a pathologist and the Chief Medical Officer for LabCorp. What I am presenting to you today is the scientific knowledge that we know as of May 6, 2020. This is a rapidly evolving area and undoubtedly we'll learn more as we continue through this pandemic. Next slide. COVID-19 is an infectious disease caused by a new coronavirus, SARS-CoV-2. The first reported case of infection came from China in January 2020. This respiratory disease that spreads from person to person poses a serious health risk. It can be associated with mild to severe disease, even resulting in death. March 11, 2020, the World Health Organization declared COVID-19 outbreak a global pandemic. As of April 19th, more than 2.4 million cases have been reported globally in more than 180 countries and all 50 states. Next. This slide includes a cartoon of the virus that causes COVID-19. The virus is a single-stranded RNA, that is ribonucleic acid virus. I will talk more about the structure of the virus in a bit. Let's begin today's discussion by reviewing more about the disease, COVID-19. The virus is transmitted most commonly by respiratory droplets from person to person. How does the virus actually cause infection? The spike on the virus that is depicted in the cartoon has a point of attachment that can bind certain human cells that have a matching receptor, such as cells that line the respiratory tract and the gastrointestinal tract. The typical symptoms associated with this infection are those that we commonly associate with a respiratory infection, such as fever, cough, but there's also shortness of breath. Some very recent reports suggest that some infected individuals may have gastrointestinal symptoms only. Some individuals are asymptomatic, most have mild disease, and others severe disease, possibly leading to death. Age distribution of the virus is important. 80% of the deaths that occur happen in individuals greater than 65 years of age, and the greatest risk of death is being over 85 years of age. Other risk factors for severe disease include chronic lung disease, hypertension, and diabetes, to name a few. Next. As I mentioned, most individuals have mild disease, 15 to 20% severe, and up to 5% critical, typically meaning that they require a mechanical ventilator. During this time period, individuals with infection will shed virus, and the highest viral shedding occurs early in the course of disease. And unfortunately, this viral shedding can occur 1 to 2 days before symptoms persist. And this is why this virus is spreading so rapidly, because individuals can shed virus even when they don't feel or appear sick. Next slide. We are all very familiar with the appearance of coronavirus, named for its array of spikes along its surface. First identified in the mid-1960s, only 7 coronaviruses to date are known to infect man. These include the first 4 listed here, and these common coronaviruses are the cause of a common cold. There are 3 which cause more severe disease. There's MERS, which stands for Middle East Respiratory Syndrome, and this first appeared in Saudi Arabia in 2012. SARS, for Severe Acute Respiratory Syndrome, which is due to SARS-CoV-1 and appeared in 2003. Very interestingly, the virus that causes SARS has not been around since 2004. And then, of course, there's SARS-CoV-2, the novel coronavirus that causes coronavirus disease 2019, which is abbreviated COVID-19. Next slide. Well, just a little refresher for you. How are bacteria different than viruses? Bacteria are single-cell organisms that can replicate on their own. Viruses, on the other hand, are incomplete organisms, as they can only reproduce by attaching themselves to cells. The basic structure of a virus is as follows. They have an envelope, a protein coat, and an inner core of genetic material, either DNA or RNA. The envelope is made of fat or lipid, and this is destabilized by soap, which will inactivate the virus, which is why it's really important that we encourage everybody to wash their hands thoroughly with soap and water to inactivate this virus. Next slide. All viruses contain nucleic acid, which is the overall name for DNA and RNA. DNA and RNA carry our genetic information. DNA contains the genetic code of the organism, while RNA translates that genetic code from DNA into proteins. The core component of all of this information are the nucleotide bases that are the building blocks of DNA and RNA. And I've listed the bases here. So for DNA, the bases are adenine, thymine, guanine, and cytosine. And for RNA, the building blocks are adenine, uracil, guanine, and cytosine. These nucleotides bind in a very specific manner. And this manner is how the RNA can replicate from DNA. So for example, you can look at the double-stranded DNA sequence that I've listed there, which is just a made-up sequence. And you can see that A always associates with T and C always associates with G. So RNA is single-stranded and it reads in a complementary fashion. It makes itself in a complementary fashion to DNA so that it becomes the message of the DNA code. So as you can see here, under the T of DNA, we have A. Under the A, we have U. And then for G, there's C, or C, there's G. So this is how the code translates from DNA to RNA. Next. As I mentioned, SARS-CoV-2 contains a single strand of RNA. There are sequences of the RNA bases, or nucleotides, that are unique to SARS-CoV-2. These sequences, when detected, indicate the presence of SARS-CoV-2 virus and are diagnostic of infection. In the laboratory, we can detect viral RNA using a molecular assay called RT-PCR, which stands for reverse transcriptase polymerase chain reaction. Next. RT-PCR allows detection of viral RNA, which is very, very tiny. And it does so by amplifying it. So reverse transcriptase PCR allows the lab to detect the specific viral RNA sequence. And it does this by using a probe. And I've depicted the probe by the small blue box in the upper left hand of this diagram. So the probe identifies the unique viral sequence that is specific for SARS-CoV-2. And then using an enzyme, reverse transcriptase, which is an enzyme that allows RNA to be converted into DNA, we take the viral RNA and convert it into DNA. We then get rid of the RNA by using an enzyme that destroys it, so we have only the copy of the viral RNA in the form of DNA. This is where the polymerase chain reaction comes in. We add the enzyme polymerase and a whole lot of nucleotides so that we can build millions and even a billion copies of that DNA. And then we'll have so much amplified DNA that we can measure it in the laboratory using a detection device. Next. LabCorp developed a very sensitive, very specific PCR assay to detect SARS-CoV-2 in samples taken from the nose or mouth. LabCorp, as you know, played a central role in commercializing PCR assays when they were first introduced nearly 30 years ago. LabCorp began work on developing a SARS-CoV-2 molecular test soon after reports of the novel coronavirus appeared. And in early March, we were the first commercial lab in the US to offer diagnostic testing for COVID-19 at our laboratory in Burlington, North Carolina. We have now performed over 1 million tests and can perform up to 65,000 per day, nearly 2 million a month. As you can imagine, at this time, we are working very closely with the White House, state governments, the CDC, and the NIH. I also want to mention at this time that our drug development arm of the company, which is Covance, is very involved in vaccine development and clinical trials involving treatments for COVID-19. Next. Once we are infected with SARS-CoV-2, how does our body fight this infection? One means that you likely are familiar with is by developing antibodies, also called immunoglobulins, that are specific to components that make up the SARS-CoV-2 virus. The antibodies can potentially bind to the virus and prevent it from attaching to human cells. And by binding, antibodies assist in removal of the virus from the body. These antibodies that are specific to the virus can be measured or detected in the laboratory, and this can tell us who has been infected. These antibodies may provide protection from reinfection. This is called immunity, but this is not always the case with all viral infections. While immunity occurs for those individuals that develop antibodies to measles, mumps, and many other viral infections, immunity is not true, for example, for HIV, the virus that causes AIDS. Besides the antibody response, the body also mounts a cellular response to infection. Specific white cells called T cells bind and clear the virus. Both antibody and cellular responses are important to fight the SARS-CoV-2 infection. Next slide. Specific antibodies to the SARS-CoV-2 virus can be fairly easily detected in the laboratory, and I'm going to try to walk you through that. The picture on the left is a microtiter plate, which is where we perform the assay. And this plate contains 96 wells. And in the little canister thing is a cross-section of one of those wells. So the bottom of these wells are coated with viral protein, say for instance, a part of the spike protein. And this is also called antigen. We then add patient sample, and a different patient sample is added to each of these 96 wells. And if that patient sample contains antibody to the viral antigen, that antibody will bind. So then we have to detect the presence of antibody, and we do that with an anti-antibody. And that anti-antibody, which is anti-IgG, is tagged with an enzyme. We then add a substrate, which is a compound that changes color in the presence of the tagged antibody. And then voila, as you can see, certain wells that contain antibody develop color, which we read in an instrument. So with this, we can determine which individuals have presence of antibody in their serum and which do not. Next. At LabCorp, we are developing our own unique antibody assays, but currently we are using high-volume qualitative antibody assays with kits that we purchase from manufacturers. We only use kits that have been reviewed by the Food and Drug Administration or are currently under review by the FDA. All of these assay kits are validated in our laboratories, meaning we study and verify their performance. I can guarantee you that the antibody assays we perform, they all perform very well, and they largely detect antibodies only to SARS-CoV-2, showing little, if any, cross-reactivity to other antibodies. This is very important, as you don't want a false positive result. That would mean you would tell somebody they have an antibody to SARS-CoV-2 when they don't. If you as businesses in this community are using a commercial lab to perform serology, that is antibody testing, it is very important that the labs use good kits and that they have been properly validated. I've also got another number on this slide, which is sensitivity. And this is the information that comes from the manufacturer. And you can see that the sensitivity for one of the assays listed here is 80%. I really need to point out that sensitivity tells you how good the assay is at picking up antibody. So the sensitivity really depends on the timing of the blood collection based on the onset of symptoms. And we evaluated the sensitivity as part of our validation studies, and we showed excellent sensitivity when those individuals get tested 10 to 14 days after onset of symptoms. So we have very good sensitivity and specificity. Next. Serology testing, that is antibody testing, provides evidence that a patient has likely been infected with the SARS-CoV-2 virus. The test ideally, as I have mentioned, should be very specific, with little or no cross-reactivity to other antibodies, such as antibodies to viruses that cause the common cold. It's important now for me to let you know what we don't know about serology. It is not yet clear which antibody response, if any, are protective. That means whether or not they provide immunity. And if we do get some protection from antibodies, we don't know how long this is sustained or over what period of time it lasts. Also, we have to be very careful about all the many antibody tests that have come to the market recently, because not all tests perform the same. They don't all perform well, I hate to say it. So with this in mind, on May 4th, the FDA updated their guidance on serology testing during this public health crisis, and they now require all FDA manufacturers to submit their validation and their testing to the FDA for review before commercial distribution of their assays. Next. As I mentioned, our understanding of this disease and the utility of the SARS-CoV-2 antibody testing is rapidly expanding. As of recently, the known utility of serology testing is to investigate who has been exposed to the virus. This test can also provide some evidence of infection if you've had an individual with symptoms suggesting COVID-19, but they didn't undergo the molecular testing or the molecular testing was negative. This may become more important as we are aware of different manifestations of the disease COVID-19, such as has been recently reported in pediatric patients where they may have only gastrointestinal symptoms. It's very important that we realize what the test cannot be used for. Serology or antibody tests for this virus, SARS-CoV-2, cannot be used to determine immunity or protection from reinfection. They cannot be used to inform a healthcare worker to return to work without personal protective equipment, and currently, we cannot use this to screen for convalescent plasma. That means plasma from individuals who have recovered from infection, as this plasma is sometimes used to treat COVID-19. Next. Last week, the World Health Organization issued a scientific brief on immunity passports in the context of COVID-19. Immunity passports are a written verification that an individual has antibody to SARS-CoV-2. And the intended use of this passport is to suggest that the individual is protected from contracting COVID-19. Because a number of countries are considering or are implementing the use of immunity passports, the WHO published this brief with the following important statements. Firstly, there is no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. And secondly, most who have recovered from COVID-19 have antibodies, but no study to date has evaluated that antibodies to SARS-CoV-2 provide immunity. Next. At this time, we would like to turn our discussion to return to work strategies. At this time, employers should assume that some employees, customers, vendors, and others in the workplace are asymptomatic viral shedders of SARS-CoV-2, and for this reason, should implement administrative and environmental controls accordingly. This is what the CDC recommends, that individuals wear a face cloth covering in public settings to avoid the spread of COVID-19 to others. This face mask or cloth covering is meant to protect others in case you are infected. The face cloth is not a substitute for social distancing. The CDC continues to recommend that people try to keep 6 feet between themselves and others. And I want to point out that the CDC website has other guidelines. Some are specific to certain industries, and it's an excellent resource if you haven't used it already. Next. A return to work policy will likely have to be gradual, and it's likely not going to be one size fits all. It's going to depend on the essential nature of the business, the type of work that is conducted at that business, the location of the business, and the health status of its workers. A return to work strategy will likely initially require continued social distancing and the use of face masks or some sort of PPE until a time when there is a vaccine widely available or effective therapy is readily available. Or we can hope that there's a time when we're all immune to this virus. The return to work strategy may include screening with temperature checks of employees, as well as vendors and customers, as well as it may include a review of symptoms, as well as a review of exposure to others who may have COVID-19. LabCorp, as of yet, does not know exactly what process will be the safest or the most effective. Next. So this return to work strategy may include both serology testing and the molecular test. So the serology testing, remember, will tell us if a worker is positive, if they have antibody. This may provide some immunity, although this has not been proven. It tells us that they have been exposed to the virus. The molecular assay is used to detect the presence of virus. The frequency of testing asymptomatic workers is yet to be determined. Symptomatic workers must be isolated and tested immediately. If a worker tests positive for SARS-CoV-2, workplace contact tracing is needed. So for this reason, businesses must have policies and procedures for workplace contact tracing developed, and they must be implemented. At this time, the CDC has recommendations regarding discontinuation of transmission-based precautions, which they issued on March 23rd. Next. I've listed those here, and the CDC currently has a test-based strategy and a non-test-based strategy. And I hope that these recommendations will be updated soon as we know more about viral shedding. So I refer you all to the CDC website to review this, but in a nutshell, the test-based strategy suggests that, and this is recommended for individuals with more severe infection. So those with COVID-19 should have resolution of fever without fever-reducing medication, improvement of respiratory symptoms, and negative molecular testing for SARS-CoV-2 on 2 occasions at least 24 hours apart. There is a non-test-based strategy that individuals should have been recovered for at least 3 days or at least 7 days have passed since the symptoms first appeared. Next. At this time, it's a real pleasure to introduce Heather Provino, who will talk to us about getting America back to work. Heather?
Thank you, Dr. Adcott. And it is truly a pleasure to share the information that we've gathered over the past 6 weeks in talking with many employers in helping getting America back to work. We have probably talked to about 200 different employers about the strategies that they're deploying. And I think this is an unprecedented time in that our strategy for deploying in the workforce is moving in parallel with the great science that is happening alongside it. So these strategies are changing moment to moment as we learn more about this virus. We like to describe what we've learned so far as fitting a typical bell curve. On one end of that bell curve, we have essential businesses that are taking extreme precaution and have come up with strategies using all three of these modalities that you see listed below as their return to work strategy on a daily basis. On the other end of that bell curve, we've seen employers who are looking to merely get a baseline of their population before they bring everybody back into the workplace, and then just do symptom checking and temperature checks to identify anybody who may have been exposed or who is displaying symptoms or presenting with a fever before they go into the workforce. What we're seeing the most common strategy sits in that actual bell of the bell curve, where employers are looking to offer symptom checking, so temperature checks and symptom questionnaires at the entrances, provide a baseline PCR test for the detection of the virus, and serology antibody tests as a baseline. They're then looking at 3 common cycles of repeat testing over a period of 8 weeks to 6 months that include either weekly, biweekly, or monthly repeat screens to ensure the safety of their workforce. As a result of these conversations, LabCorp has created an employer solution to offer all 3 of these out in the work environment, starting with symptom checking and providing the workforce that can man entrances, screen employees prior to the entrance into work stations, and also provide temperature checks. In addition, we've been able to provide on-site PCR, so assisted collection, in an end-to-end solution, which I'll talk about shortly, as well as serology antibody testing, both on-site at the employer location and also through our patient service centers. On our roadmap is the exciting addition of our Pixel at-home kit, which is currently only deployed for healthcare workers and first responders. We're hoping to get that out to the employer population sometime early summer. Next slide. All of these solutions are meant to help the employer understand the risk in their workforce and stay ahead of mass outbreaks within the workplace. What we've heard loud and clear from employers that we have been talking with is that they need the opportunity to design their own strategy and have a cohesive end-to-end solution. So we have kind of created a build your own return to work screening and testing program. In this program, we provide everything necessary, including the physician ordering and oversight of the program, client success and implementation for project management, a secure online portal for registration to ensure that we're maintaining social distancing that Dr. Adcock discussed, all of the staffing and logistics support for on-site collection, and communication support to ensure the message gets out to the workforce in a correct manner. We're also providing all of the data and reporting necessary at both the state level to the departments of health, as well as the CDC, and an aggregate report package for the employer so you know how many have been tested, how many viruses have been detected, and how many individuals with antibodies exist within your workforce. All of these solutions can be bundled together or provided separately in multiple different modalities. And we're happy to discuss those modalities as you develop your strategies and consult on which modalities would work best for your workforce. Some of the things that we would want to know to help you build these programs is the volume and frequency of testing that you would like, the timing of those tests, including all shift work that you might have. We'd also want to confirm the number of employees, build a screening schedule that works for your return to work strategy, and determine the locations that are in need of immediate deployment and those that will be returning to work at a later time. At this point, Dr. Adcott and I would like to take your questions.
Thank you so much. I'm going to start administering the Q&A. First question is, if an employee tests positive for COVID-19 and contact tracing determines that 2 additional employees had contact with the infected employee, when should the 2 employees that had contact with the infected employee be tested? If the 2 employees test negative, is there a time period when they need to be retested?
Well, that's a good question. I don't think anybody really knows the answer to that question at this time. Exactly how long it takes for the virus to replicate to the point that you would detect it in the assay. And hopefully, as I had mentioned, this is an evolving science, and hopefully we'll have more guidance as to that type of an, so we can develop that type of an answer for you. But I would think the first test should be within 24 hours. Heather, do you have anything you want to add?
I think exactly, Dr. Adcott, and what we've seen employers do is try to remove them from mass contact with the whole workforce population, and then provide testing for those individuals. And then once those tests come back, make sure that symptoms don't develop over time.
Thank you. Next question. What testing options do we have if one in a group gain notice of infection regionally for GSO triad area? Isolation of all for 14 days is not realistic. If there is a means of rapid testing only, those infected could be isolated, allowing the business to continue with only a short pause. Let me know if I need to reread that.
If you could, that would be helpful.
So I'm trying to understand, what testing options do we have if one in a group gain notice of infection regionally for the triad area? Is it isolation for all 14 days? If that is not realistic, is there a means of rapid testing only for those infected, and for those to be isolated, allowing the business to continue with only a short pause? I believe I interpreted that.
Thank you for that. So if I understand, you've got a business and you have one individual who's infected, and you're wondering what to do with the remainder of the individual. Obviously, the infected individual needs to be isolated and removed from the workforce. And in addition, you could test the other individuals, but keep in mind that the molecular testing is a point in time. It only tells you on that day of testing, or that hour that you tested them, that they're not infected. They could become infected through another source at the grocery store and then be positive the next day. So it's really not a simple situation. So I don't know. I think these are very difficult, very good questions. Heather, do you have any input?
What we've noticed for employers that have maybe more of a production facility where this is a potential, and if they have detected somebody who ends up testing positive, what we have seen is a a rapid employer response where they're absolutely implementing symptom and temperature checks before people gain entrance into those common workspaces. And then they may do PCR testing, if not daily, for a period of 14 days. They may do it every other day, or certainly available if somebody presents with symptoms or a fever, may do a PCR test right then and there, just so that they can keep manufacturing and production moving forward while monitoring that population a little bit more closely so that they don't shut down full production. Obviously, if there are mass outbreaks, we have seen that they've actually had to close down the work site for a period of 2 weeks to ensure that they do keep those individuals who may have been infected sequestered until the 14-day lag period is up before they return everybody to work. But those have been the more severe outbreaks that we've seen.
And then Heather, they would also wear the masks and practice social distancing.
Absolutely. And I think that's really important, Dr. Adcott. We're talking about testing a lot, but all of the common practices that we're all having to practice, even at the grocery store, are super important in the work site as well. So maintaining that social distancing, using protective equipment provide, washing hands, and maintaining that social distance in the workspace as much as possible. We realize some production folks do work closer than the 6 feet, but using the use of PPE in that case is very important, and the access to hand sanitizer and hand washing stations is also very important.
Thank you. Next question. I run a grocery store. I'm here to find out how we can get testing, and I don't have time to sit through tons of details. Can anyone tell me if testing is available and how we can get it done, and if there will be a cost?
So we've got some of our operational folks. Tracy Butler, would you care to take this question?
Sure, we do have testing available today for anyone who's interested in directing, say, to a local, if you don't have a clinician who can order that test today, a lot of the urgent care centers or local health systems are able to place that order. And it would come into LabCorp, and we can get that test back usually within a day to 2 days. Back to that clinician. That's one way to do it. We also have the employer services option that Heather just walks you through for people who want to do a broader testing for your whole employee population. And then we are coming out daily with new options with regards to the ability for patients or employees to order testing either online. The serology test or the antibody test just went live yesterday via LabCorp's website for patients who may be interested in getting that just by ordering online and coming to one of our collection facilities. So there's many options. My suggestion would be to reach out to me or Dr. Clay Gibson on this call. We'll help coordinate that if anyone has specific needs, and we can walk you through what may be the best given your situation.
Thank you. Next question. The spread of the virus is most commonly spread by respiratory droplets. What other ways have been proven, such as surface contamination with the virus and physical touching?
So there have been some studies that have suggested that when the respiratory droplet falls on a surface, that can also spread the infection. And the viability of the virus, that is how long it remains alive, varies based on what kind of a surface it falls on, whether it's paper or copper or stainless steel. And that information is available on the web. You can perform searches to look for that. But that is another means of transmitting the disease.
Thank you. What is the cost of the serology testing per individual?
Again, I'll have Tracy answer that, Tracy Butler.
Yeah, so the serology testing is priced at $50. And that is across the board for anyone, really. That's through CMS and our relationship on the testing globally.
Thank you. Next question. Who would we speak to about reviewing a plan for an essential employer who has not had employees not work? So we are looking for due diligence versus a return to work plan.
I can take that one. We'd be happy to speak to you about that. A lot of the employers that we're currently offering services to are in that essential business category where they haven't had a break in employees being at the work site. So happy to share some of the learnings we've had from that and some of the solutions that those employers are implementing.
Thank you. Next question. We are currently working as an essential business, so we are not looking for return to work options, but rather what may be available to us to protect our workers while they are working. Would we have access to the same tool or programs you offer for ready to work, return to work?
Absolutely. Again, happy to have the conversation and understand what the needs are and see what the strategies in that environment and look at the risk of a mass outbreak for you.
I believe the connection was a little scattered. Can you repeat that answer for me, Heather?
Absolutely. We'd be happy, just like the previous question, to talk through some of the strategies that these employers have implemented and how we can keep that workforce or that workspace healthy and try to prevent a bigger outbreak from occurring.
Thank you for that. Next question. Does LabCorp recommend PCR and rapid serology testing on site? And does LabCorp have PCR and serology tests or just the PCR and partners with the serology tests? With all of the antibody tests out there, how does the company select the correct one?
I can answer part of that. Of course, we at LabCorp offer both the PCR and the serology testing. And we do, currently for the serology testing, use manufactured kits that we test in-house. And we test them extensively using hundreds of samples. And we only offer kits that testing from manufacturers that perform excellently. And so I can guarantee that the testing that we perform is of the highest standard. There was another question to that about where the testing is offered. And so we, in some of our hospitals, we've helped implement some point of care testing, but currently the testing is performed in our laboratories, of which we have many. And then it's the collection where we've got the new Pixel collection kit where individuals can collect samples for the PCR testing at home. That's the molecular testing. And we're also looking at options for doing a finger stick at home that can be sent through the mail.
Thank you. If a person is not symptomatic but is infected, will the person test positive? In other words, what is the utility of testing asymptomatic persons generally? Thank you for your presentation and your work.
Thank you. So there is much more we have to learn about this whole process, this whole infection. But virus can be detected in asymptomatic individuals, and that is the reason that, you know, they are considered for testing. There has to be, however, some period of time where an individual is infected before they have enough virus to actually be detected in a sample. And what that period of time is, we really don't know.
Okay. Is your return to work program scalable and affordable for a business like a retailer with multiple stores or work sites in multiple states?
Heather, do you want to take that one, or maybe Tracy or Heather?
Either
Go
one.
ahead, Heather.
Sure. I think, we work with employers in designing a program that fits their needs, and that includes budgetary needs. So absolutely have worked with organizations with multiple work sites. Very needs of those work sites. So again, I think kind of when building the ability to how often frequency is very customizable and really designed to fit your needs.
So I believe that was distorted. Could you hear properly? I don't know if that's on my side.
I think go ahead, Tracy.
I can summarize that. So we can scale, again, with Heather's program, because LabCorp is a national company. We would be willing to talk to you and help determine, based on your budgetary needs, the best option for you. And certainly that could be across multiple states.
Thank you. Next question. I would like to know the answer to the question about a place to send an employee when, I don't know what this is saying, telecasts, when they're being told that they do need to be tested. So the question is, they want an answer to a place to send an employee when they need to be tested. Could this please be addressed?
So this is Tracy. I'll take that. For a patient, for someone who you think may be exhibiting symptoms, that can be either sent through the local physician, their local physician, or an urgent care center to have that order created, and that would come to us. So you can either go to the doctor's office, and then we can get that testing done. In addition, if you've got a patient who is showing symptoms, they can go online and they can either order a kit that will be shipped to their house via our program called Pixel. Again, it's on our website. We'll provide information for that with distribution of the presentation, as well as if you're thinking about just the antibody testing, they can actually go online, order that today, and they can even go to one of our collection sites, and we have more than 75 across North Carolina, and come in, have the blood drawn. That'll be sent to our lab, and that result will go directly back to that patient.
Thank you. I think we'll take one more question. Where can we get, how would we sign up for on-site testing at your workplace?
Heather.
Absolutely. So we'd be happy to set up a conversation and explore what the needs are, and help design a program for your work site. If you wanted to get a hold of myself or Tracy Butler, we'd be able to set that up.
Thank you so much for that. We are about 2 minutes before the end of the hour. I want to allow Tracy Butler some time to close the webinar. Tracy?
So I want to thank everyone today for your time and attention. I know it was a lot of information, a lot of science to understand. I think the main takeaway is if you have questions and you need our involvement as you prepare your back to work strategies, certainly feel free to reach out directly to me, and we'll make sure our information is sent to everyone on the call, but to myself or Heather. And we'll help walk you through those. I also want to reinforce that, again, today, testing is available through your clinicians or your local health department, hospital. So it doesn't have to go, directly for a workforce strategy. You can work with your local clinicians in your area to be able to get testing, especially for smaller organizations. So I just want to make sure that everyone's clear on that. And I want to clarify, I had mentioned about the testing for serology. It's $50 today. We have not yet gotten final guidance from CMS, but whatever CMS determines will be the price that we agree to. So I just want to clarify that for everyone, and we'll again be glad to give more detail on any aspect of the program for specific entities that are interested.
Thank you, Tracy. Thank you to everyone for attending today's presentation on COVID-19 laboratory testing for virus presence and antibody response. We hope you found today's content valuable. You will receive a brief survey of the webinar via email. We would appreciate any feedback you can provide to allow us to improve these sessions. Again, the recording of today's webinar will be made available to you via email within 24 hours of the webinar. You will also provide LabCorp's contact information in our follow-up email. Thank you all. Stay safe and healthy during this time. And thank you to all of our presenters today. Have a great day.